When you or a loved one is experiencing an emergency, minutes count. Having a team of highly trained, top quality doctors, nurses, and healthcare technicians ready to provide the best possible care is exactly what you need. And it's exactly what you can expect at Catholic Health. Today, we'll learn about the care and resources provided at their emergency departments and urgent care centers available across Long Island. That's on Stronger Together with Dr. Dave. Hello and welcome to Catholic Health Stronger Together with Dr. Dave. Today we're talking about Catholic Health's emergency medicine services. To learn more about the resources available at Catholic Health, we spoke with the system's Chief Operating Officer, Gary Havokin, whose EMS background provides him with a unique perspective on emergency care.
My EMS background started really when I was little. My grandmother got sick at my house, and I remember I was 11 years old, and she had a seizure, and I didn't know what to do with it. Not that I could have helped much anyways, but I ran away from it. And so from that day forward, I was very intrigued by, the EMS folks, professionals that were coming into the house and how they managed her care. And so it always kind of stuck with me. And then when I went into high school, there was a EMT, an emergency medical technician program available when I became a junior. And so I joined it to learn a little bit more about EMS and what that was all about. And I caught the bug. And so I've been in EMS now for about 35 years. I'm dating myself. And then after college, I went on to become a paramedic. So I've been a paramedic for 30 years. I still actively have a license in that space too. I think one thing that I've always loved about the fact that I have a clinical background is that while I got into healthcare administration, I can understand, the medical jargon. I can understand what it's like to take care of a patient. I can understand what it's like to manage family members as part of it and the community around a patient who's ill. And ultimately translating that into my current role, you learn chaos management and you learn how to kind of, calm down in a time of stress. And as everybody realizes, our lives are stressful. And so that EMS has really taught me how to manage that stress from that perspective. And so that's been a very valuable lesson that I've learned, plus the clinical knowledge that I gained through the years has been very helpful in my career. Catholic Health understands the importance of emergency medicine. We have a CEO who's an ER physician, COO who's a paramedic by background, and the importance of emergency medicine is totally aligned with our values and our mission because it's community-based, right? We have 70-ish% of our total patient population on the inpatient side of the hospital comes in through the emergency department, so it really is the front door. And the communities that send patients into the emergency department are all partners with the hospitals. And then when we look at EMS, that's about 20 to 30% of the total volume of patients that come in through the emergency department. Our relationship with EMS, our relationship with communities, and how we represent ourselves from an emergency department perspective is very important to that continuum of patient care. We realize that we have to continually reinvest to make sure that our facilities are top-notch, that our clinicians have the right space to work, our patients have the greatest place to be, and their family members have an area to come to take part in that overall care of their patients. So investing in that emergency department is really essential. And investing in the resources that it takes for us to manage our relationships with the communities through EMS liaisons and EMS medical directors who reach out to the communities and support them have been wonderful. But I think, the structure, the investment in the bricks and mortar with regard to the patient flow, the beautification of emergency departments, the fact that we want EMS rooms in place, all of that is absolutely essential to the success of the organization. So it's a priority for us. As a matter of fact, we've invested over the last 3 years in 5 of 6 of our hospitals, our acute care hospitals. We've invested significant dollars in each one of our emergency departments. I've had ribbon cuttings in each one. And then the final one that's being worked on now, Good Samaritan University Hospital, will have a 75-bed emergency department bay and a brand new tower that we've been building over the last 5 to 7 years. So Our investment in emergency medicine and EMS is significant, and it shows in our EDs and what they look like today. The relationships that we build with the local ambulance services, the local fire departments, the local police departments, the commercial ambulance services that are on Long Island are extremely important, and we have relationships built with all of those assets. And you have to have a partnership, because you together collectively are taking care of that patient from their moment of greatest need all the way through their discharge to the next step in their continuum of care. So that partnership, that clinical partnership, the quality assessment component of it, but really having those that you trust to represent the values of Catholic Health upon that initial call for help from that individual is absolutely essential in the care of that patient. We have a level 1 trauma center. We have, every emergency department has a variety of different levels of care for our patients. And we are going to continue to grow our emergency services departments. We're going to grow, what it looks like from an EMS relationship perspective into our communities. And we really respect and understand that is the front door for the majority of the patients that come into our hospital. And it's our goal to continue to be the number one choice for care for patients within our communities, and that's how we're going to accomplish that goal.
Thank you, Gary. It's great to hear the investments Catholic Health is making into its emergency departments. Coming up next, we'll learn more about the clinical resources available to patients and their families. You're watching Stronger Together with Dr. Dave. Welcome back to Catholic Health Stronger Together with Dr. Dave. Emergency room doctors and nurses have to be prepared for anything: heart attacks, strokes, serious trauma injuries. They are highly trained in treating it all in a moment's notice. Our next guest is Catholic Health's Chairman of Emergency Medicine, Dr. Christopher Rayo, who shares what it's like in the emergency department, how his team handles it all.
Emergency medicine is a team sport, and it's not just the physician, it's all of the nurses and the nursing care that they're able to provide, our ancillary support, working in collaboration with other departments and specialties throughout the hospital, and working with our clinical teams. It's really a team game, and we have to all work together to coordinate the care of so many patients coming through our EDs across the system. So there really is no normal day in emergency medicine. I think the draw of emergency physicians to work in our specialty is that every day is different. On a typical shift, we'll see 20, 30 patients, and they will come in with injuries and illnesses ranging from minor lacerations that we need to repair, to major traumas, to patients who are septic and critically ill. So, why emergency physicians love the specialty is because every day is very different. So patients are seen immediately by our clinical team, typically a nurse. When they enter into the department, they get triaged rapidly, and we aim to see all patients within 15 minutes from the time they hit the door. A physician is seeing them and evaluating them and initiating their care. We're lucky here at Good Sam that we have pretty much every specialty on call. We have a very well coordinated on-call list of any specialty that we need to coordinate the care of our patients with. Oftentimes those specialists are in the hospital, such as trauma. We also utilize some telehealth programs. So for stroke patients, in order to access a neurologist immediately, we actually use a telehealth program where the physician will zoom in on a laptop computer. But we have every day we're able to see who's on call for what specialty, and we're able to contact them immediately by phone. And in some cases, the physician is in the house and they'll be down to the emergency department within minutes. Being a level 1 trauma center here is really, really important for the community here on the South Shore of Long Island. Being level 1 just means that we're able to handle any type of trauma, and we're able to manage those cases from the time that the trauma occurs all the way through to rehabilitation. We have an in-house trauma attending surgeon 24/7 in the building. We have backup surgeons on call if we have, say, a multi-trauma case where we need multiple trauma surgeons. And then the entire team, from the emergency department physicians to the trauma surgeons. We're all trained in trauma-specific protocols. That education is ongoing, so we're required to do education on an annual basis. As a Level 1 Trauma Center, we're also required to do trauma research, and we also do a lot of outreach to the community in terms of prevention of trauma. So, we're doing a lot of education to our community members as well. Here at Good Sam, we have a separate pediatric emergency department, one of a kind on the South Shore of Long Island. We have a dedicated team of pediatric trained emergency physicians. The environment in a pediatric ED is very different than in a general or adult emergency department, and we feel like that's a lot more soothing to kids who are coming in obviously sick, nervous, anxious. So we feel that the environment really promotes the care of those patients. We have also started a pediatric emergency medicine fellowship training program where we're training physicians to really specialize in the care in pediatric emergencies. And that not only is going to help train our physicians of the future here for Catholic Health, but it really just elevates the level of care in our pediatric ED. I think here at Catholic Health, the emergency departments and services are growing. There's been a lot of investment in not only expanding, but also modernizing our emergency departments across the system. We're very, very focused on our motto, which is 24/7, 365. We're able to handle anything that walks through the door, and we're very focused on reducing wait times and getting our community taken care of as quickly and efficiently as possible. Here at Good Sam, we also have a major $500 million construction project going on, which is our new patient care pavilion. That's going to provide our emergency department a new home that's roughly triple the size of the current ED. That department is going to equip us to match the excellent clinical care we deliver to an environment that our patients deserve. It's going to feature 3 state-of-the-art CAT scanners right in the center of our ED to really speed up imaging times and get our patients taken care of. And one of the things we're most excited about is it's going to feature a 10-bedded trauma critical care area and an elevator right up to the operating rooms, really just to expedite the process of taking care of the sickest patients that present. Another thing that's very important is the access to our emergency department is going to really be a lot smoother, being located right on Montauk Highway. We also have dedicated ambulance bays that have been expanded for EMS to get in and out quickly. So it's really just going to provide a much more efficient process for our patients coming to the ED. So one of the things that we've done a lot better over the course of the last several years is really becoming more of a system in emergency medicine. So all of our emergency department directors and chairpersons, we're very connected and we work very well together, and we take best practices from one emergency department and bring it to the others, and it's really elevated the level of care for our patients.
Coming up next, we'll learn about the new urgent care options Catholic Health is offering its patients on Long Island. You're watching Stronger Together with Dr. Dave. Welcome back to Catholic Health, Stronger Together with Dr. Dave. Today we've been talking about the facilities and resources available at Catholic Health's emergency departments. But what should you do when you need help and it's not an emergency? Catholic Health first opened its Ambulatory and Urgent Care Center in Centereach to solve this issue. The medical experts there can treat a variety of illnesses and injuries, including stitches, splints, and casts. The best news, you can walk in or make an appointment online. Ambulatory and urgent care at Centereach has been such a big success that Catholic Health recently opened another urgent care site at Station Yards in Ronkonkoma. Catholic Health President and CEO Dr. Patrick O'Shaughnessy was there for the grand opening and gives us a sneak peek inside the new building.
Hi, Dr. Patrick O'Shaughnessy here at Station Yards. Such an exciting time as we're ribbon cutting this transformational mixed-use site. You can see here Catholic Health is well represented. We have our EMS here. You can see the center square, all the retail space surrounded by residential units, which I've learned are already at 80% leased. So just a beautiful facility. Come on, let's take a look. You're gonna get to see, there's our community outreach bus, all of our amazing healthcare heroes who are doing some transformational work to help connect to our community for their needs. And right behind us, behind that van, you're gonna see a brand new state-of-the-art Catholic Health Urgent Care Center. So excited to kick this off, so excited to be part of this community. Let's go inside and take a look. Well, hello. How's everyone doing? How exciting. It looks amazing in here. You can see this is our whole dedicated team of urgent care experts here ready to care for members in the community. A beautiful new state-of-the-art space. So that whole square outside is going to be filled with Long Islanders. And again, our job is to help keep them healthy. And I know the team here does a great job. So we have 7-day availability and people can just walk in. Obviously it's urgent care, right? I'm an ED doc. I used to work in some centers like this. So they can just come in off the street, out of their apartment, come right in and be seen.
They can also scan a QR code to reserve their spots.
Perfect, so can actually reserve online. Yes. Isn't that great? And we've got 6 state-of-the-art exam rooms. We've got radiography here so we can, check for any lumps, bumps and bruises, broken bones. Great board-certified emergency physicians and emergency care team here to care for everyone. So really looks fantastic. So thrilled to be working with you.
Thank you. Same. Yeah.
All right. And we like to say our closing line will always be, long live Long Island, long live you.
That's great news. And what a beautiful site in Ronkonkoma. Thank you to all of my guests today as we learned about the amazing emergency services available at Catholic Health. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.